Healthcare reform is also on the mind of First Lady Michelle Obama. She acknowledges the many hurdles to passing it, but insists it will remain a top priority for the president. I sat down to talk exclusively with her about it on Friday in Philadelphia, where she was promoting her first major initiative as First Lady.
If you can do it here, we can do it around the country.
At a Philadelphia school, First Lady Michelle Obama talks about her mission to eradicate childhood obesity, an epidemic that leads to $147 billion a year in medical costs, an issue that goes hand in hand with health care reform. Deadlines keep getting missed for passing health care. Obstacles keep mounting. Will your husband ever give up on trying to find a compromise?
We can't afford to give up. Not in this country. We're already seeing premiums going up for people who do have insurance, and there's still millions of Americans that are underinsured or uninsured.
The single biggest driver of our deficits is healthcare spending.
You can't imagine a scenario where he would not finish the job on healthcare?
My hope is that the country understands that we need to do this, right? This is a we thing. We all have to work together and decide that this is a priority, and we're going to make the compromises and changes that need to happen to get health care to everyone.
Unfortunately, at the moment, though, health care is being held hostage by partisanship. I talked to Senator Evan Bayh this week after he quit, threw his hands up and said, "I can't handle the partisanship, I'm out of here." Democrats are losing a lot of legislators. Either they're leaving or incumbents are losing. How do you stop the bleeding?
These are tough times. When times are tough, it's hard on the people who were in power, both Republicans and Democrats. It's the nature of the beast, but we have to stay focused.
What do you think could help Democrats keep those crucial seats?
Some of it takes time. Some of it takes time for people to, believe that jobs are coming back and to feel the improvement that is actually occurring. Because things are getting better, and sometimes people need to feel it before they believe that it's actually working.
What do you think is a reasonable amount of time to ask people to wait?
Oh, I couldn't tell you. I couldn't even begin to tell you that. I think it's hard to know what's reasonable, but I do know that it's more than a year.
And Mrs. Obama is going to be very busy promoting her new initiative to fight obesity over the coming months. But this was interesting. She said that she would be willing to take a break from that if she thought it would help to go campaign for some of those Democratic incumbents who may be in trouble in November. The president has done so unsuccessfully for 3 of them, but she has an approval rating of 71%. So she might just be who they want on the stump with her.